A milestone at Texas Children's Fetal Center. The surgeons who pioneered an in-utero procedure for spina bifida recently performed their 100th surgery of its kind.
It is remarkable. We got to talk to the very first mom and child who underwent this procedure 6 years ago. They truly helped pave the way for other families. Now, a quick warning, this does involve surgical video, but we did blur a lot of it.
She's right there, I know she is.
It may look like just another day on the lake with a dad and sons, but being out here means everything to 6-year-old Grayson. And he caught one this big.
Oh, how much pounds was that? That big bass I caught?
I think it was 3.5 pounds.
3.5 pounds.
Grayson is the first child in the world to undergo a novel procedure while his mom was still pregnant with him. Doctors wanted to repair his spinal cord that was developing improperly because of spina bifida.
It was very scary. When the doctor told us, ultrasound tech found that he had spina bifida, and we had no idea what that was.
Up until this point, only a risky procedure for moms was available that would wipe out her chance of other pregnancies. However, a team of specialists at Texas Children's Hospital was on a mission to lower that risk. Althea packed her bags in Louisiana and headed to Houston. She met up with one of the brilliant minds behind it, Dr. Michael Belfort, OB/GYN-in-chief at Texas Children's Pavilion for Women.
And this wasn't something that just came up out of the blue one day. We said, well, let's do this. We were fighting public opinion, and certainly within the scientific community, there was a lot of distrust of the technique. So I think that moving forward with Althea, starting our program, we were able to slowly convince people that this is the right thing to do for mothers.
Althea says she didn't think twice about it.
There was hope, and there was a way to give him a normal life, and we just hit the ground running. And
I'll never forget this. She said, somebody has to be first, and I'm okay to do that. And, what a brave and courageous woman and brave family when you're offered something that is, clearly experimental, to say somebody has to be first.
I'm very grateful because our journey has been one for the books. I'm so blessed.
At the time, the procedure was considered investigational and was overseen by 4 safety groups. Dr. Belfort spent hundreds of hours in simulation preparing for it. Instead of a large incision to the uterus, he made several small ones with a camera leading the way. Grayson weighed only 1.5 pounds when he became the first to undergo it. Look at the video Texas children shared with us of his tiny body in the womb.
The goal was to incise around what we call a placode, which is the exposed area of spine, and then to cover that with tissue and close up the leaking area of the spinal cord and the lower spine.
That very procedure has given Grayson the gift of mobility. His life would have been drastically different without it.
That he might have been confined to a wheelchair with bowel and bladder issues and significant other problems that could range from cognitive dysfunction to infected shunts and all sorts of things. So I think his life could have been very, very different. And we're just so happy to see this little boy interacting with his family and being able to do things like go fishing and have a normal life.
Grayson is thriving academically as he heads into 1st grade and has found his calling on the lake. He can name every fish and bait, and fishing is a sport he can pull off.
Grayson knows that there's a lack thereof, something missing physically. So where he can strive, he takes the bull by the horn and he goes with it.
His family can't even fathom what his future would have been like without the procedure. Plus, Grayson gets to cherish a new sibling on the way because his mom is successfully carrying her 3rd pregnancy and is due any day.
God only knows where we would be today if we didn't have them.
Dr. Belfort feels the same about her and says he and many other families will be forever grateful she had faith to be the first. And I want to give a big thanks to Cody Duty and Alan Kramer, photographers, as well as Texas Children's, for sharing those photos and videos so that I could better tell that story. Isn't it amazing? He's doing great, and it's really neat to be able to share that.
Yeah. Well, I'm just so happy that she did agree to be first, because you said how many people she's helped?
99 people have now done it, and successfully, and have done so well. And just so you better understand spina bifida, it is the most common spinal defect in the U.S. It affects about 2,000 babies every year.